prostate cancer. And for the black man, it is 1 in 4 that is diagnosed with prostate cancer. Right, we just looked at the prostate, and it is really small, and it's actually the size of a walnut. We did have some sort of examples of the prostate. But as men get older, this prostate can get bigger and bigger and then causes a problem. This may be that it presses on the water pipe and you notice that your water flow, your flow for urine doesn't work as well as. This may be the time when your wife has said to you, "Why, man, you get up too many times a night. Go to the GP and see what is going on with my waterworks and with your waterworks." So off you go, and when you visit the GP for advice, and as part of your consultation, the PSA blood test is requested, and only at this point that you are told you have a problem with the PSA being elevated, and then you are referred to the hospital for further investigation. So in the UK, about 1 in 8 men will get prostate cancer. If you're black, your risk is doubles to 1 in 4. So if you are a black man over 45, your risks are higher. And as you get older, from 45 onwards, obviously the risk is greater. Now, if you have a father or a brother, and I'm speaking as if there's a lot of men here, they're not, I know they're not, but I know the women are here and are usually the instigators of getting the men to the GP surgery, so I'm speaking on as if the men are all here. So if you have a father or brother who's had prostate cancer, or if your mum or sister has had breast cancer, you are strongly recommended you speak to your GP about having the PSA blood test. Now, you might wonder why breast cancer, prostate cancer, but there is a gene called the BRCA gene, which are very big in both cancers. And so that's why if you've had breast cancer, it's more likely that the men could have prostate cancer at some point in their lives. Have you heard that before?
No.
Have you heard that before?
It's about the grandmother. Just the mother, not the grandmother.
It might be in the family, as long as if it's in the family, yes, in breast cancer.
Not just the mother.
No, I would say once you know that there's a link, I would feel that the urge to go to the GP and talk to your GP about it. So if there's some men saying, well, I'm not quite 45 yet, but it is uncommon for men under 45 to get prostate cancer. But there's always the potential, there's never, because of the nature of men being black men, there is that possibility. So it's important to get this checked out with your GP and express any concerns about prostate cancer, especially if you have a family history. Do I hear someone say, but I don't have any symptoms? Should I still go to the GP? The answer is yes. By the nature that you're black, over 40, and have a family history. You should have a PSA blood. That is important that you don't wait for symptoms. Cancer is a silent disease which can become more aggressive in black men, so you have to be aware there's a criteria of 45 and above to be tested for prostate cancer. I see a hand over there.
Yeah. Is there a reason why it's more aggressive in black men than men in general?
We talked about this, but we really don't know why that is. And to be honest, it's like anything, it's down to research, and then research is about funding. So I understand when I was at FAB meeting that there's a possibility there's going to be a research going ahead, but it's going to be in London about this and to see whether we can identify why that it is the case.
Prostate cancer UK, I think, looked at it, but they haven't come up with any answers, but we see it in our job. But I see younger black men as opposed to white men, so it's almost, we're not surprised if we see between age 40 to 50 black men. So we know that it is a reality, unfortunately.
When you say black men, do you mean, what about Asian men or mixed, are they saying mixed parentage men as well?
Yes.
What about the Asian? Where do they, they're not white?
I think they're in between, and I think also if they've got a family history, I would encourage them to go and get to see the GP for more information. So if they class themselves as black, yes, some do, probably some don't, but then I would encourage them to go and on ahead and do that.
Asian, regarding your question, is 1 in 12.
1 in 12?
Yes.
Asian.
Thank you for that, because I didn't know that statistic. Anybody else got a question? Yes. Ms. Aiken.
My question is it the food or the drinks that we drink cause the black men? Or is it?
No, it's not food related. It's a biochemical makeup of that person.
Thank you.
I saw another hand.
Yeah, when you say there's no symptoms of, in my particular case, when you went for a week, you couldn't control it. It's just like one long week. You can't stop it, you can't put it short, you can't, well, don't get in the car. That's just one of the symptoms. Otherwise, you have to wait till it's done itself.
Yeah, because as I've mentioned before, as men get older, the prostate enlarges. When with it enlarging, it squeezes onto the water pipe, which then alters the way that you urinate. So you might find that it's very slow. It might be, I do a bit enough start, and that's when you think, no, there is something wrong, and that's when you go to your GP. And as part of that consultation, they will request a PSA blood test, or they should.
Thank you.
Even with an enlarged prostate, that can cause a lot of problems. It doesn't have to be cancer. If you look at the model and what you see, it's just a really thin tube where you wee out of the urethra, so it doesn't take much for the prostate to be big to really squeeze it. Yeah.
I see another hand, just this lady.
Yes.
That's right.
Can you swap the mics?
Yes, as I was saying, I said some people don't have no symptom whatever. A few years ago, myself, my husband and myself, we went to Jamaica. When we went out there, one of his brother, younger brother, had prostate. So I asked him for what symptom he did have. He said, he told my husband. Anyhow, I said to him, when you come back to England here, I would advise you to go to your doctor. He said, but I haven't got any symptom. I said, brother, yes, I know what your younger brother had it. He said he's not. Anyway, I went to the nurse. I said, nurse, I would love you to do a blood test. Send her phone that my husband could come and do a blood test. And I told her that the younger brother had it. Anyhow, they called him in and he did a blood test. The Monday, and by Wednesday they called him in and said, you must come in now because they see something in his blood and they're going to take it further. When he went, they told him that he had cancer. We went to City Hospital and he did at the end endoscopy test, I think. Endoscopy.
No, it won't be an
No, urology.
Went to urology.
Yeah,
Urology.
urology. And when we went there, the doctor said to him, how do you know that you have cancer? He said, I did not know. But my wife insists that I do the test. He said to him, if you didn't love your wife, you better love her now because you had a lot of years. Because when they tested, it was in the bracket of between 3 and 4. And they do the MRI and they get it out. No, it's a few years ago now. And he used to do tests every year. No, they don't call him again. But thanks be to God, he's all right.
Yeah, he's doing his PSA yearly or every 6 months or so.
Yeah, he does it yearly.
Yeah.
Yeah.
Okay.
But he didn't have any symptoms.
Yeah, and you can see why I say the women are very important in these men's life, because they are very quiet, very shy about their health. And I think, you know, as much as there's no men here, the women, please feed this back, watch your men, you know, their habits, and just encourage them to go. There's another hand. Just one minute.
The sister mentioned earlier that that particular person did not have a symptom. Is it a fact that the sign of prostate cancer at times don't have symptoms? Are the
That's
symptoms vary?
That's right, yes. It's just like any other checks that women all go through, like, you know, we have cervical smear. It doesn't mean that we've got the cancer, but we check in to see whether there's any cancer there. So the idea of checking the prostate at 45 without symptom is to make sure we catch the cancer early. So there are different gradings to prostate cancer. It can be very low, which means we don't need to do anything but just keep an eye on the cancer. And those kind of cancers, you might likely to die with it than of it. But there are those that are very aggressive, which either need treatment and or in any way, it might be that we need to remove it, we need some radiotherapy, we need to put you on hormones. So really the idea is to catch it as early as we can. And in catching it early as we can, it means that it prevents, you know, the inevitable. Yeah, that's
Yeah, so if you have your PSA done, I would say you know the 40, 45, particularly the black man, even white, they say certainly by 50, but if dad or brother has history of it, then even in white it's 45. But if you just have your PSA taken, then in 6 months' time, when you have it, or a year, have it time again, you can see the pattern, and then you'll be able to see if there's a rise and pick on it really early.
So those that we find that do come with and have prostate cancer, we call that very low cancer, they are kept on our books at the hospital, and we do regular checks. We say we'll send out a letter saying go and have a blood test, and we look and make a comparison with the last blood test. Now if there's an increase, a significant increase I should say, then we maybe have to change the plan. But that's why we keep an eye on it rather than the GP, so that if it's caught, if anything needs doing, we spot it, not the GP.
Hello, Mary.
I am.
Good afternoon. Good to see you
Thank
here.
you.
Could you please explain to the attendees what specifically the PSA means?
This PSA, for those who don't know, is called a prostate-specific antigen. So basically it's a protein that tends to be released in the bloodstream when there's a problem with the PSA. Now, it doesn't always mean that there is cancer, because if the prostate is enlarged, then there's going to be protein leaking into the bloodstream. But it's down to us now to do further intervention just to see whether there is a significant or a sinister cause for it.
So, question, which is more effective? Is it the blood test or the finger?
It's a starting point.
Yeah.
Both a starting point.
Yeah, it's all you want.
It's the door finger.
Okay. Now, the PSA is the starting point. Now, your GP may want to. The GP may want to do a digital sort of examination, they call it, but you don't have to. At that point of seeing the GP, you can just do the blood test to start with and to see whether there is an increase or there's a rise in the PSA. But if it does help if he can do it there and then, because it gives him a better idea of what is going on with the prostate.
The MRI gives us a little bit more definite issue, so it's sort of a pattern. And then at that point, we would go for biopsy if it's a shadow on the MRI.
I see a hand.
Yes, I think the evangelist just asked a question, but I'm going to ask you anyway, because I realize that because of the nature of the test, the old time test, because some don't know that that has changed. You know, some men are afraid to go because of the nature of the test.
Yeah, you mean the digital examination?
Yeah.
Yeah. I know, I was part of the community clinic some years back, and I was one of the nurses that did the blood test and did the DRE, just a short name. And some men just didn't like the thought of having that done. And I can understand why, but I guess because I was a female, it made it a little bit more easier to do. But when you go and it's your GP and it's a man, I know the men do not like the thought of that. But it doesn't need to be done straight away, as we said. PSA first. You don't even have to have it at the GP, but if you certainly come to the hospital, the consultant will probably need to do that. But you'll have an MRI scan before, which will give us an idea if there is a problem with the prostate.
I think we have an answer.
Yeah, good afternoon everybody. So when you do go to your doctors and request a blood test, or they might invite you in to have a blood test, it may well be there is want to check the cholesterol and things like that. It will not say to you, I will do a PSA test. You must insist. You say, oh, can you include PSA test for me, please? They say, yes, of course I can. It's not a normal thing to give you a PSA test. You might be invited, as I say, I don't want to repeat myself, cholesterol, things like that. But you must add on, can you please do my PSA? And they'll say yes. They won't advise you to have one. But they'll say, yes, I'll do it for you. And then the ball kicks in, you know.
That's right, and that's where knowledge comes in, and this is why we have to spread the word amongst each other about prostate cancer. That when you are going to the GP, and you know that you're high risk, and you know the knowledge that at 45 black men can have prostate cancer, and you know you've got it in the family. When you go, you know through the knowledge that you can ask for that test. Yes, they're going to ask you why. Have you got symptoms? And you may not have symptoms like we said, but for the very fact that you're black, you're over 45, and may have a family history, you insist.
So, just a question, I don't know if you covered it tonight, but again,
Yeah.
so if I'm not 40 as yet,
Gosh,
so at what age you say, like from 45 going?
45.
Okay.
The major earlier, if you've got a family history, and again, and to reduce your anxiety about it, there's no reason why they shouldn't do it, because it is only a blood test.
But are there any, like, maybe persons who may be under 40 who have never been diagnosed with prostate cancer from experience?
It is rare, and that's why I said I don't know of anyone coming through the clinic that's been 40. But 45 most definitely. But like I said, if you are concerned about it, there's no reason why your GP can't give you a blood test. Insist on a blood test if you've got a family history.
So I just asked the question on the behalf of the young men that is below 14 to relax, you know?
Yes, relax. Before
That's right.
40,
Before
no.
40, no. As far as we am aware, I don't know of that myself. There may be some statistics.
Sorry to interrupt,
That's
but
fine.
although it's very rare
Yes.
for a 40-year-old
Yeah.
to actually be diagnosed, or obviously at that age there's very rarely, there are very often no symptoms anyway, because at that age too young. But in the FAB group, which we're part of, I think our group member now stands at about 70, or thereabouts, plus men. The majority of them have been diagnosed, have gone to treatment of some kind, or survivors from being treated some time ago, long term, 10 years plus. We have a couple of 40-year-olds who have been diagnosed.
I've looked after 40,
So it's rare.
It's rare.
So you're quite correct,
Yeah.
Margaret, to say it's rare, but there have been occasions, there are
That's
cases,
right,
it does happen. Like anything else, there's no definite, this cannot happen.
It's where you draw
It
a
can
line.
happen.
Yeah, it's where you draw a line with these testing, and I guess the government's decided that 45 is the better part.
And that's actually
And
the,
that's what it,
I believe that's actually the current strategy,
that's right.
age-wise, of PC UK as well.
It is, yeah, it is. Yeah. But I certainly know that if there is a family history, and I was really concerned about 40, and probably you may have some problems with your water works, and just press it, a blood test. It's only a blood test. It's simply enough to do it.
Can I just say, this blood test, you don't do overtaking this blood test. You don't go overtaking that blood test, so you're not putting them out. The nurse will be taking the blood from you. My daughter works in the haematology unit at the Queen's May. It's all fully automated. They literally come in there, they shoot all these blood samples, whether it's a male or a female sample, and it's all fully made, and within about less than a minute, boom, and everything like your blood. There's that many thousands, literally on a daily basis, being taken for nothing for sure. And it has to be a very efficient system. It's fully automated, and you know straight away. You don't have to wait 9 weeks, 6 months, 5 weeks, whatever it's say to you. It's there, it's on the computer, it's in the system. And I do believe more, you can now check your own records.
Yes,
NHS.
And there's another way of checking, because when the GP might say, I don't want to do this, you're not suitable, you're not reached the age, you're not 45, or you've got no symptoms. On Prostate Cancer UK, there is a checker. So if you want to go on that and just look at your risk factors, you can actually take that printout to your GP and discuss those risk factors with him as to why he feels, from what you've got down here, why he feels that you don't need to have a PSA. So on Prostate Cancer website, there is a check-out of your risk factors. Okay? So, from your phone from FAB, says, there's a question that someone might ask is, are there other black men I can talk to about prostate cancer? And most definitely yes. We do put them in touch with FAB, Friends and Brethren. I don't know if anyone's heard of that. Have you ladies heard of Friends and Brethren? They've been going around, how long have you been?
Since 2012.
Since 2012. Does anyone know Rose Thompson? Yeah? She's passed, yeah. And she helped with all of this, brought us together with FAB. And FAB has been in our lives ever since. So any patients who come to our clinic who are unsure about even treatment, yes, their PSA is elevated, and because of the side effects, they're not sure whether they want to go ahead with any treatment. They just want to talk to someone to see how they've recovered from any of the treatments that they've had to go through. We put them in touch with FAB. Now, FAB's been excellent. I don't know what we would do without FAB, to be honest. I ring up Royden or ring up the team and I said, I've got a patient here who's really concerned. He really needs to speak to someone about his diagnosis. Can you speak to them for me? I'm sure they will ring that patient, and in fact, they will come with the patient to the hospital to their appointments. They do take that patient under their wing, and I really do thank them very much for their support that they give to our patient. Okay. I see another hand.
What I find with most black men, especially young ones or people in the age bracket of getting cancer, what they do, tend to hide it from other people.
Yeah.
They hide it.
Yes.
When you tell them about it, they just hide it.
Yeah.
You know what I mean? So sometimes you talk to them until you blow in your face. Next minute, they're gone. And you're wondering, what's wrong with them? He died of cancer. So they don't tell nobody nothing.
It is seen, I think cancer on a whole is one of those diseases that people feel ashamed of. It's a cultural thing, and I don't think it's cultural, I think it's across the board, to be honest. People just feel, well, what have I done? What have I done to get cancer? So when they're told they got cancer, they really struggle to share it. And I just remember a patient that had a diagnosis, was going to discuss it with his wife, and up to this day, I've not seen the man back in the clinic. He's disappeared. So, you know, as I say, it's a shame. They feel like it's a shame, but you shouldn't. Illness is illness. Everybody is going to get some kind of illness in their life. It so happens it's cancer, but like anything we say, if it's caught early, it's treatable. Yes, you might have to be on medication. Yes, it might affect your sex life. Yes, your bladder may not work as well as it did. But you know what? Women, would you prefer your men to be here with you rather than in the grave?
Yep.
Wouldn't you? Wouldn't you?
Yes.
You want your men here with you to support you with your children, with your family, you know. So this shame, you need to just bury this shame, to be honest. Everybody gets ill.
And you say treatment.
Sorry?
If someone's diagnosed with prostate cancer, what is their treatment? Is it just medication or?
No. Well, it varies because it depends on the grade of the cancer. There's different gradings, to the low to the quite aggressive. There's treatments such as radiotherapy. If it's gone to the bones, it may have chemotherapy and radiotherapy. If it's localized and it's just contained in the prostate, then they are well and of a certain age, then they can have the prostate removed. Yeah. So there's things called brachytherapy. They put seeds into the prostate, radiating, just like radiotherapy radiates from the inside out, just to kill the cancer cells. But of course, it has an impact on things like your waterworks, and it might have an impact on the erections. And to be honest, you know, the erections seem to be, so for some men, not all men, it's a big thing because of the side effects of the treatment. So there again, you have to weigh up being here or not here. Reoccur.
It's like any cancer.
It's like any cancer, it can do. As long as we've treated, once you've been diagnosed with cancer, we don't really let you go.
No.
To be honest, we still got quite a tight rein on. If we don't manage you, we expect the GP to do that for you. But on the other occasion, there have been reoccurrence.
Yeah, because it's about 8-9 years since my husband.
Yeah.
I told him that once you have it, it will reoccur. It's not gone completely. But he don't believe me when I tell him that he said it's gone.
Is he just on hormones? It's just on hormones?
No, he haven't got. He's on nothing now. Only they used to do blood tests like every year, but they stop now.
Right.
They don't call him back to do it.
Well, they should still do that.
They don't, they give it
Now, Rosie, sorry for being a bit personal. How old is your husband?
80, no, not until September, 84 plus.
You know, but even so, they should still, if he's not on any treatment, if he's not on any treatment, they should still then be monitoring him. Because he may need treatment. He may, if he's not on hormones, injections,
No,
then they should still be doing his PSA.
they did it about 2-3 years ago, they haven't.
No, they should be still doing it.
So, how do I know that?
You go back to your GP.
Go
And
back
ask
to
them
the
and say,
GP.
yes, I've been told by the hospital
Yeah.
that my husband should be having, if it's not 6 monthly, but yearly at least, you know,
For
blood
3
tests.
years, they have one.
No, they should, no, I can ask them for one.
Okay, thank you.
Yeah.
I should just say prostate cancer is a slower cancer. It's a lot slower than if you think of liver and lung. So even when our prostate cancer patients are it's aggressive or it's spread in the veins, we can control it for like years. Not where you think of, yeah. Yes.
Some of this
So that's my question, right? I think when I walked in on it earlier, you said that prostate cancer, it doesn't come about as a result of what you eat, right? And well, from what I've known historically, or what I've known, generally other cancer types, they would happen as a consequence or as a result of your lifestyle choices, including what you eat. Is it different from other cancers in that regard?
To be honest, we don't have any evidence yet. There's research hasn't been done to know even why black men are 1 in 4 to get prostate cancer. To be honest, when they present there, they tend to be a more aggressive form. And we don't really know why. So I think we're still waiting for that research to say it. But to be honest, like anything in life, or healthy lifestyle is always important, which will help with any diseases.
And actually some foods help prostate, so broccoli. So if you go on Prostate Cancer UK, they would say about tomatoes, it's the licopene, it's the skin. So even tinned tomatoes in a cooking or any type of tomatoes with the skin on, and broccoli and pomegranate juice. They're the super foods. But we've seen the PSA go down because someone suddenly changed their broccoli intake. So we know that it works the opposite way.
But we don't know whether it's part of your diet that's caused the problem.
Yes. Going back to being checked for prostate cancer, right? I've got prostate cancer. I'm at stage 4, right? How did they get there? 2017, I went to see my doctor. I'm a little bit shocked what happened. 2017, I went to see my doctor because I used to weigh a lot, regular, every 5-10 minutes, go to the toilet. So I went to see my GP, and I sat in his office, and I said, I need to have a medical because I'm weighing a lot. And I spoke with him, and this doctor said to me, it will cost a lot of money for this test. This is what he's telling me. And I said, what are you talking about? It costs a lot of money. I've been paying my national insurance from the time I came to this country, so don't tell me no nonsense. You know what I mean? Are you really getting angry with him now? I said, I need to go and have it. I need to see somebody, a specialist. So it was backward and forward. So in the end, he decided to send me up at the eulogy. Well, I go to the eulogy and they did this flow rate and MRI and all sort of stuff, you know. And then they called me in one day. I went in, I sat in his office, the doctor's office, up at the city hospital. And he said to me, after all these tests, lots of tests, MRI, all sort of stuff. And then I sat in his office, and then he said, oh, are you here alone? I said, yes, I'm on my own. He said, I've got some bad news and good news for you. Which one do you want first? I said to him, God is a witness. I said to him, God is good. Just give me. He gave me the bad news first, that I've got cancer. And the good news, it was just a dot on the prostate. And it was contained inside the prostate. Right? So he then continued to explain to me the various avenues we can go down for my treatment. So after explaining all these avenues, he asked me which one would I want. I said, you cannot ask me that, I don't know. So I said to him, look, I want you to be truthful to me. Let's reverse situations. I'm here and you're here. Which one would you choose? He said, radiotherapy. So I went along with that. Had the treatment, 2017, 8 years after, I was good. I was good. Then, you have to go in and have tests. They call you in for different tests. And it shows up again. It resurfaced. But this time in my lymph node, right? So if you explain to them what the lymph node is afterwards, they will know what I'm talking about. So I went back on radiotherapy. The first of the radiotherapy I had 42 sessions. Right? 42 sessions of radiotherapy. Then it came back and I had another 12 sessions of radiotherapy. Right? And then recently, they called me in and had some MRI and they said, all right, you got to come in, we need to talk to you. It showed up at my back some spots at the back. Right? So when I sat in his office, I asked him, what's happening? He said, well, we find some stuff at the back. I said, what does that mean? Does that mean you are going on to stage 4 cancer? Stage 4 cancer. I said, okay. So I asked him the question, how long have I got? I want to know. He said, 4 years. Right? So I looked at him again. As always, I said, God is good, it is what it is. But we're going to treat you with chemotherapy. So right now, I'm on chemo. I had my first session around 2 weeks ago. So it's every 3 weeks, you go in, they put this thing in your cannula. Yeah, in your arm and it just grip. And it lasts about 1 hour and 15 minutes, and then you can go home. Right? They recommend I should have 10 sessions of chemo every 3 weeks. Right? You have a chemo session. So my last session will be on January the 10th. But when you have these things, you cannot give up. You cannot give up. You got to be physically strong and mentally, right? And you have to get all these negative thoughts out of your mind. Because you can easily go down that route. And if you go down that route, that's it for you. Your body will have nothing to fight with. So you got to be positive all the time. And strong all the time. And you have a group of people around you. Macmillans, family members and friends. You need them around you. You just cannot sit down and mope around the house and feel sad and you give up.
Yeah.
You can't give up. You got to be strong all the time. And everybody handles situations differently. You will handle it different to me. I am a very strong, determined person. You might be just sad in the sad zone. So when I'm telling you how I handle it now, you will ask, why is this person so calm about it? Why is he calm? You have to be, it is what it is. It is what it is. God is good.
Yes, all the time. All the time.
Right? You just can't, once you believe in Him, and you put your trust in Him, and you're helping yourself at the same time. You cannot sit down and say, God, don't do this, and you're sitting down. It don't work like that. It don't work like that. You got to put in the hours. You got to put hours in, and be strong, and believe.
Yes.
I'm going to be here longer than 4 years. I know that. I know that. I'm going to live like my mom. My mom is 99 in September.
Wow.
She'll be 100 next year. I'll be around for a long while. But I'll look after myself. I'll look after myself. I don't give up. And the thing about it, once you get on the path, you must always have a diary. A diary, and you record how, as you go along, and that will help other people in the situation. If you don't write down things, you forget. You understand? Always write down things. I keep a diary. I don't want that much thick. How my path was up to this day.
And there you have it, shows your patient experience. And for those who've never been to FAB, it doesn't mean that you have to have prostate cancer to go. You can actually go to their meetings, sit and listen to, you know, some of the men and their journeys that they've been through. And they are still sounding very, very positive about their cancer. There's leaflets on the table, and on the back is also booklets about prostate cancer, the signs and the symptoms. There is a sheet on the back as well, just if you want to write things down about your history, how to approach your GP, just write that down and then we just present it. So you've got something written down in front of you so you can ask him questions. So I found that on Prostate Cancer UK website, and I thought it was a very good tool to use.
But just a question I want to ask. Maybe if you have ever experienced such thing. As I heard my brother spoke. Speak louder. Yeah. As I heard my brother spoke right there, and they told him that he had 4 more years to live.
Yeah.
Now, we as a church body, what we have experienced, and you will tell me if you have experienced it likewise, that persons who were actually diagnosed with cancer, and of course, prayer was made for them, and when they went back, they came back, they were cancer-free.
Yes.
I'm asking with your experience in your job, have you ever had anyone to come to you who, of course, they was diagnosed with stage 4 cancer, and of course prayer was made for them, and they tell you all the testimonies?
No, because at the very start the patient would have been put on treatment, unless the patient has declined treatment, and they can come back to us and tell us that, but we've never seen it, because they usually go on treatment straight away, more or less, when they get their diagnosis.
We both have faith, so we know that God is our strength, but God also gave the gift to people to have the medical skills, and I believe that, you know, God gives me and Martha a job to do, and our doctors say prayer is wonderful, and church support, it really helps. It makes people more positive, it makes people stronger, but it doesn't always cure.
That's right. Two more hands and nothing, somebody else to come and speak, isn't it?
It's me again, Mother.
Okay.
The question I want to ask is this: how is it possible for these things to slip off the radar? I mean, if people leave the clinic and they should do the 6-month check or the yearly check, because why? As I said, it slipped through the fingers or off the radar that these people don't continue to do their checks. Because I had similar experience, because I was diagnosed with prostate in 2017, and I came to and I did the operation in 2018, and when I was discharged from the clinic, I was told by the urology department that they would release me to the GP, and they would start with the 6-month clinic. Then they hand me on. And nothing. And I ring the GP myself, and they were telling, they gave me the runaround. Until about 2 years and something later, I was on the phone with the GP, and the GP said to me, I'm not Mr. Williams, I'm seeing something. You were supposed to do a 6-month then manual. Have you done it? I said, yeah, I've seen it on the send me a letter. Yeah, let me straighten this one. Yes, you called me in for one of them, blood form to go to you, do some tests. And when I went to the clinic, I did the test. I moved to city. I did the test, and it was a little bit higher than expected. Anyway, they gave me a couple of months, and then called me again to go another blood test, and it was where it should be. So if it is something that's serious, why?
Meanwhile, the GP didn't continue.
Yes. The urology did not check for
If you've been discharged back to your GP would have been instructed to do that, PSA. I will always say to the patients, please do not rely on the GP. If you find that the GP has not done your PSA in 6 months, then you ring them up and say, the letter says, and the letter from the consultant urology will say that you are being discharged and you should continue 6-monthly PSA blood test indefinitely.
Well, that's what I did, but I think I made a error there. I should have gone into the surgery and pick up my first.
That's it. I'm not going, I wouldn't say it's your fault, because it shouldn't be your fault. I mean, we've given the GP instructions, and it really should be them that should be doing this. But knowing what you know, I would say I would be knocking on their door and say, as far as I'm aware, I'm supposed to have 6 monthly blood tests, why am I not having it? And the other thing I will say to patients, if this isn't happening, I don't know how long I'm going to be at City Hospital, but if the GP is not doing it, and he can't give you an answer why, ring the hospital. You know who your consultant is, or speak to one of the nurses, and he says, as far as I'm aware, I'm supposed to have 6 months of PSA, and my GP is not doing that. As much as you've been discharged 3, 4, 5 years, if you give us a call, we'll look into it for you.
The next question is, when a person do the operation, whether in the surgery or the chemo, how long it normally takes, in your experience, for it to come back?
We can't say for sure, to be honest. Everyone's diagnosis is their diagnosis, and it's an individual thing. We don't know how long it's going to be before that returns. Hence why we say a PSA indefinitely.
Thank you.
Is there one more?
No, give Pastor Hall. Give the men. Let me be last.
Okay.
Is this the last one then?
Yes.
Are there any superfoods that men could?
My colleagues just mentioned it.
Yeah, I heard you said broccoli and
Tomatoes.
pomegranate. Yeah, and what else is there that men?
Nothing that we know. I mean, to be honest, if you go on Prostate Cancer website, they do have a dietary, and in fact there's a book on the back about prostate cancer and diet. You can have a look through that, but I don't know of anything specific. But to be honest, all we know that a healthy living sort of helps, doesn't it?
Okay, now there are lots of things that we hear as men, and I don't know professionally if there is any, if it makes any sense. We hear about alkaline foods, and that the more alkaline your body is, the less
Disease can spread.
You are to catch diseases. Is there any link?
And this is where I said the research hasn't come down yet for all of this for us to say it would make a difference, because I don't know if it will make a difference.
Because what I'm thinking, since cancer's been there for so long,
Yeah.
and it's taken so many lives, I thought there would be more research on those things to know exactly. Because as I said, there are loads of things that you hear over the internet. Drink this, drink that. Water that is above 8 pH and those kind of things. Drink is alkaline, so that's why.
Because there's different types of cancer there. These cancers are different. It's cancer, but they're different. It's just like prostate cancer, but it's slow growing. But other cancers can be fast growing. I guess, again, it depends at what point you're diagnosed. But if you were diagnosed today, if you were to come back in 2 weeks' time, your diagnosis would change.
last one. It's not even a question, it's a comment. I work in health research, but I'm not like a research nurse or a researcher. And I also have like a lot of conditions. When I go to the GP, it's like we do see like an increase in Afro-Caribbean women, and we do see an increase in black men, but the research is not done. And my organization is actually really pushing. In order for research to be done within our community, we actually need to volunteer and be part of the studies to get the answers. And so they are doing a lot of awareness that you can join committees. So at our workplace, we approve if the research is ethical. But you know, as research nurses, you can come up with. For me, when I'm there, I've got so much questions like why is it just black men that's come to the UK? Like there's a lot of why, but I'm not a research nurse. But I think that there is opportunities. We have a few nurses here to actually go into these areas, because the moment you sit there, they will tell you that there's no evidence or we don't know why. And I think because the more educated we are, it's up to us, it's up to our community to actually answer some of these questions. We're seeing it happening around each and every one of us. So you can go into my organization, it's Health Research Authority. You can volunteer to be on the committee, but you can also just ask when you're at the doctors if there's any studies that I can be part of, even as a healthy volunteer, and get into the research so that we can get the answers.
We do have one, periodically we have research. At the moment we've got one called Pure Eyes, and we try to enrol patients who are being diagnosed with really low prostate cancer. And basically what they're looking at is just dipping the urine to see whether they can pick up from that whether a person's got prostate cancer. So that's a trial that's going on at the moment called Pure Eyes.
Last question, not from me. Okay. I just put the disclaimer there. Somebody asked the question, they were shy to ask the question. If somebody remains like sexually active as well a man, is it the chances high or low causing prostate cancer?
Can't spread it either, can you?
Is that all the questions? Can I sit down? Oh, there was one. Did you have a question? No?
Yes?
Just one. This is the very last one.
Good afternoon, and thank you so much for your presentation. It has been very informative. I just wanted to know, for men, are there preventative measures? Because earlier on you mentioned if you had somebody in the family that has breast cancer, it also has a link to prostate cancer. Or the two types of cancer are similar. So if they have somebody who's had breast cancer in the family, they do stand a chance of getting prostate cancer. Are there preventative measures that they could implement that would reduce the chances that you know of that would help? Excellent.
No, there isn't anything. If it's in the family, if it's part of the family makeup, it's more likely that there's a possibility. You know, hence why we said, aware that you've got cancer in the family, that you go and get checked out at 45, because nobody really knows. So we identify the BRCA genes in prostate, and it's the same one in breast.
Okay.
Hence why they are two that are linked together. So if one grandma, whoever's had it in the family, first breast, there's a possibility that you can have prostate cancer.
Mm. That's
Okay?
very interesting. Thank you, Mama. You can have some soup. The soup is ready.
Thank you very much, Mama, for this information, and I want to thank God for what we've heard today. As one of the gentlemen spoke, he said that you have to insist that you want the PSA test, you said, right?
Yes.
Yeah, because I've had blood tests done before, and well, nothing came out of it, so but I didn't specify. They called me for blood tests twice, and they never called me to say anything's wrong, but I don't know exactly what it done. So next time I'll make sure I specify that. There's one thing I've learned today, that I need a PSA done. Yeah? All right, so thank you very much for all this information. Put all this together there. Well done, well done, well done. And we're just going to take a short break before we have the fab men to present. We're just going to take a short break for now. So a short 15-20 minutes break, and we're going to come right back so you can drink some water. I don't know about the food situation, what it's like now, but we can drink some water and get something for now, yeah? So thank you very much, and may God continue to bless you all.